In Australia, this man has a terrifying condition that sets him apart from others.
The leg felt alien, just didn't belong there. It didn't feel like it was mine.
Sydney, Australia. Dave Openshaw relaxes after a hard week at work. He's a computer technician.
Come on, buddy, you can do it.
He's also a father of 4.
Wait for your ball to come out, and then you get another go.
But there's one way in which Dave stands out from the crowd.
How have you been?
Yeah, not too bad.
He recently lost the bottom half of his right leg.
Just take your...
And it's what he's always wished for. Dave was born a healthy baby. He grew up in a happy home and did all the things other little boys do. But Dave didn't feel like other children.
At age 4, 5, I knew there was something a bit different about me.
As long as he can remember, Dave thought his right leg wasn't meant to be part of his body.
The leg felt alien, just didn't belong there. I knew it was mine, knew there was nothing wrong with it. It just didn't feel like it was mine.
From childhood, he was always too scared to confess his strange thoughts.
I didn't talk to anybody. I just knew myself that it's not normal thoughts. The biggest fear would have been if I had told someone that they'd go tell everyone and that they'd have the finger pointed at me that I was crazy. Every day waking up knowing that limb's not going to fall off today, but still hoping that it will.
He withdrew into himself to a place of complete isolation.
Very lonely, very scary. I actually felt like I was the only one in the world with this.
For most people, the thought of losing a limb is horrifying, but not for Dave Openshaw.
When I was 13, 14, I accidentally fell into a drain, cut open on the shin, about the spot that I wanted, put dirt in it, didn't clean it, tried to get it infected so that they would have to cut it off.
Despite his sabotage, the leg recovered. Dave reached adulthood and started his own family. On the outside, everything seemed in order. But on the inside, nothing had changed.
My feelings were all over the place. Depressed, sad, completely upset that my leg hadn't fallen off overnight. The feelings never actually went away.
Then one day, while surfing the web, Dave stumbled across a chat room of other people who had unwanted limbs. He discovered the condition had a name: Body Integrity Identity Disorder, or BIID.
B.I.I.D. refers to a condition in which a person who's otherwise completely normal, and it's important to emphasize that, mentally and physically completely normal, has a strong desire to amputate an arm or a leg, and has had this desire ever since childhood.
Dave found that BIID is rare, and that, like him, many sufferers keep their conditions secret for fear of being stigmatized. Nobody knows for sure how many people have the disorder, but for the first time in his life, Dave began to feel that he wasn't alone.
It made me feel a little bit better about myself. Just talking to an online community, I made some more friends, people that understood where I was coming from.
He also tracked down Chris Ryan, a psychiatrist who understood his condition.
They know it's there, they know it's a normal leg, it works just like any other leg. But its presence there is terribly distressing for them. They just really wish it wasn't there. It's extremely hard for the rest of us to understand that because it's the exact opposite of what we would want.
BIID literally feels like having an extra limb For non-sufferers, it's the equivalent of having a third arm or leg.
It can cause so much pain that people can be driven to trying to chop off their own legs. For things to have got that bad must mean that it's a pretty terrible thing to have, I think.
So terrible that people damage or mutilate their limbs, forcing doctors to amputate. Reports tell of others who lay on train tracks, shoot themselves with a shotgun, or use a chainsaw to amputate healthy arms or legs. Experts report that those who manage to lose an unwanted limb have few regrets.
After the limb is amputated, the patient feels much less depressed and much less stressed. Basically, they feel they're happier. What you hear from the patients is that they feel more complete, more normal.
Dave believed that he too would feel more complete by losing his right leg. But even psychiatrists who sympathize with the sufferers are highly reluctant to recommend amputation.
Because the surgical solution is so drastic and irreversible, I would never recommend somebody who is struggling with this that that's the first thing they should consider.
In the US and Australia, amputating a healthy limb could leave a surgeon open to criminal charges. With surgery ruled out as an option, Dave's torment continued. The term B.I.I.D. was coined to reflect similarities with another identity disorder.
To try to understand what the phenomenon is, it's easiest to compare it to a condition which at one point in time was equally considered to be bizarre and is now completely accepted as a fact, which is gender identity disorder, also known as transgender.
Gender identity disorder, GID, is a condition where people feel they've been born into the wrong body.
In that condition, an individual is born male, but has the sense that they should have been born female, that it's like their anatomy doesn't match their internal sense of self.
For those with the condition, GID is not a matter of choice, as this transgender couple testifies.
As many people would tend to think, is we are choosing to be transgendered. It is not a choice. It is something physiological and psychological that occurs at birth.
For people with GID, there's often only one solution: surgery. To alter their bodies to match their gender image of themselves.
And B.I.I.D. is very, very similar. There's a sense of unease, a chronic sense that things are not right.
B.I.I.D. researchers noticed two common factors among sufferers, apart from their desire to lose a limb. First, they show no signs of mental disturbance.
Their intelligence is normal, they're emotionally intact, they're not obviously hysterical or mentally disturbed in any way. You wouldn't be able to tell from talking to them for an hour. You would have them as a friend. There's nothing abnormal about them.
And second, they all know exactly where they want the surgeon's scalpel to cut.
They can take a felt pen and draw the line, a very specific line along which they want the amputation to be done.
Dave knew he wanted his leg cut off exactly 2 inches below the knee.
If it was just merely a cry for help or a desire to attract attention to themselves, why would the exact line along the amputation, along which they desire the amputation, matter so much? This suggests to me that there's a physiological reason, something going on in the brain, rather than purely psychological, an attempt to draw attention to themselves or a Freudian sexual paraphilia of some kind.
But even though Dave now had a name for his condition, it didn't change the fact that he wanted his leg gone.
Okay, this is how you feel, and it's never going to go away until the leg's gone.
He felt he had tried every avenue. Therapy didn't work, and no surgeon would agree to amputate his leg. So in March 2008, Dave decided to take matters into his own hands. And what he did was truly horrifying. In Sydney, Australia, Dave Openshaw seems like any other member of society. He's not excluded for reasons of religion, culture, or lifestyle. Yet he's always felt like a misfit.
It's the constant debate in my head, going through that I was crazy. that you're not supposed to think like this, to try and put it aside and still have it crawl back. Pure hell, I suppose.
Dave suffers from an agonizing medical condition called B.I.I.D. For 28 years, he had a powerful urge to remove his right leg just below the knee. Then, in 2007, he traveled to San Diego, where a team at the University of California was carrying out groundbreaking research into the condition. Their studies focused on a specific area of the brain, the parietal lobe.
We had this hypothesis that there's something wrong in the right superior parietal lobule where you construct your body image. Maybe in these patients, congenitally, a piece of this body image is missing. You and I have the complete body image. Maybe in these people, one leg is missing.
In this test, a researcher taps on the subject's leg. The sensors pick up the reaction in the brain, and a response registers in the parietal lobe.
So what we see in our control subject is that we have normal parietal lobe activation in response to touching the skin.
But when researchers carry out the same test on Dave Openshaw,
And in patient David Openshaw, in this same area that we should see activation, we see none.
his parietal lobe registers no response.
This back portion of the head, the superior parietal lobe, remains completely inactive, even though we're touching his affected limb.
It seems Dave's neurological body map is incomplete. His brain is telling him his lower right leg simply isn't there. For Professor Ramachandran, such results are clues that B.I.I.D. could be a brain malfunction.
Well, there are strong hints that it's neurological, but at this point, the evidence is suggestive, maybe even compelling, but it's not conclusive.
Compelling, but the scientific data meant little to Dave, so long as his leg remained.
The tests in San Diego, it made a bit of a difference. But I didn't care as long as the leg was gone.
A month after returning to Australia from San Diego, he decided to take matters into his own hands.
On that particular morning, sent the kids to school. Took a bit of a deep breath, some thoughts, what's going on? This is sort of the point of no return. This is what I want.
What follows is a reenactment of Dave's actions on March 8th, 2008.
Set myself up, put the ice into the bucket.
Though he calls it ice, the substance is in fact a chemical with a temperature below minus 100 degrees Fahrenheit.
Put my leg in, put ice around it.
Dave is about to freeze his own leg until it dies. The temperature of his leg begins to drop. At 30 degrees, ice crystals form inside the leg's cells. As the temperature continues to drop, the blood stops flowing. Then, the limb begins to die. He could easily lose his life in this attempt to kill his leg. He could suffocate from the chemical fumes or develop a fatal blood clot.
The pain when it was in the bucket, it was a stingy feeling. My hands hurt, so I ended up having to put socks on my hands to put the ice in.
Other people who try taking a limb pass out from the pain and give up. But Dave is determined.
I actually went through a range of emotions while sitting there. Excited, bit panicky here and there.
Once his leg goes numb, he simply sits and waits.
I knew in my head to do it properly, it was going to be a minimum of 4 hours. I got the 6. Joe came home early.
Dave's girlfriend, Jo, calls an ambulance.
When I did lift the foot out of the bucket and put it on the floor, it was frozen solid. When it hit the floor, kablump.
He's rushed to the hospital, where the attending physician can barely believe his eyes.
David's condition I'd never heard about, but it's quite ironic that here's a patient that normally you would think would be terribly fearful of having a limb removed. But not in this particular case. He was wanting it. That's why he came here, to have it removed.
The surgeon waits, hopeful that the leg will recover. But it only gets worse and worse. Dave waits for 10 agonizing days while doctors deliberate.
Whilst we faced quite a good deal of dilemma and angst amongst ourselves in removing what appeared to be a damaged but normal limb, eventually that limb became a lethal limb. We had no option but to remove his leg by virtue of the fact that the leg had become rotten.
When Dave wakes up from his operation, his life is forever changed. He'll spend the rest of his days with only one leg. But incredible though it seems, the anxiety and depression that had been with him all his life suddenly dissipates.
It actually took a few days to kick in and work out that it was real, that it was finally gone. It wasn't some big dream that I was having. But from then, I was over the moon.
How's that feeling on the end?
Dave is now disabled, but happy. Although he went to such extreme lengths to get rid of his leg, he now uses a prosthetic limb in its place.
Right, let's have another walk.
It helps him get around without the mental stress.
When I look down at my original leg, it was more alien than what the prosthetic is when I look at it.
Even if it is conclusively proven that B.I.I.D is a brain malfunction, amputating a limb will remain a huge decision for both doctor and patient.
He has to weigh the pros and cons and say, look, it's going to disable me, it's going to make life very difficult, but it's going to make me feel much better. So this is an ethical choice for the patient mainly, and then the decision has to be made jointly by the surgeon and the patient.
For most people, Dave's extraordinary course of action would be unthinkable, but his psychiatrist has mixed feelings about it.
I don't think it's up to me to say it was the wrong thing to do. I certainly wasn't happy to hear about it. I was very worried about him. I think from his perspective, it's pretty clear. He's much happier in himself than he was before. He has no regrets. But I think it would have been much better if we'd been in a position to be able to provide better help for him.
Researchers hope to develop a therapy to relieve people like Dave of the intolerable urge to destroy their own limbs. Dave took action that most people would consider taboo. But as a result, he finally feels complete, his true self, and able to connect with others.
Before I did get rid of the leg, yeah, I felt I didn't belong, sort of an outsider, bit of a loner. But now that it is gone, it's a complete turnaround. I actually belong in society.
With his right leg gone, he feels free from the mental anguish that haunted him from childhood. Dave Openshaw no longer feels like a misfit.